What should parents know about childhood immunizations?
Dr. Lalaine Mortera will join us next to explain the important role of childhood immunizations as well as well-child visits.
Stay tuned.
Hello, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Today we're going to talk about childhood immunizations. Our guest is Dr. Lalaine Mortera.
Thank you for joining us. This is such an important topic.
Thank you.
Hello,
and you're a
Hello,
pediatrician?
Andrea. Yes, I am.
Great to have you here.
Thank you.
So immunizations, let's talk about immunizations. In the lay public, there's been an awful lot of discussion about their efficacy, whether they work, and also whether they cause disease. It even made it into the presidential debates, and I was very unhappy to see an ophthalmologist backing down to the president-elect, or whatever he was at that point.
So personally, there's no controversy.
There's no and I think this all came from a paper years ago, which has since been withdrawn and discredited.
Yes.
Is that correct?
Yes, yes.
And maybe say a few words. There's been a lot of studies about immunizations, and that's not to say they don't have side effects. They do, but in terms of immunizations causing autism, is there any evidence at all that immunizations cause autism?
It is very good for people or entities to question, because we are trying to make the vaccines as safe as possible, as much as possible. So each and every question that comes up, each and every controversy that comes up, there are going to be a response of studies and further studies to support or discredit whatever the new findings are. So that's why we are trying to make it as safe as possible. And so far, the way it is right now, the benefits of the vaccines outweighs the risk of the side effects.
Right, and the side effects we're talking about are, there is the Guillain-Barré in some vaccines, which is a form of paralysis.
Which is quite rare.
Which is very, very rare and reversible when it generally occurs.
As I've said, it's always a balance. So if the balance tilts over to the other side, we don't hesitate to get rid of the vaccines, right? So
and I think what a lot of people don't realize is the diseases themselves are not benign childhood diseases.
Yes,
we were talking before the show. Both you and I have lived in environments where there was no polio vaccine, there was no mumps vaccine, no measles vaccine, no chickenpox vaccine. And I remember kids in my kindergarten class who were paralyzed by polio. I remember a child who was permanently brain damaged by mumps meningitis. So sort of letting a child get these diseases naturally is not necessarily less risky than having the vaccine. In fact, it is less risky to get the vaccine.
It is less risky to get the vaccine. That is why it's still being recommended. In terms of the side effects, there will always be a side effect with everything. Even simple acetaminophen can cause side effects, right? So
well, getting behind going to the corner market, there are the side effects. You can get in an accident, you can roll the car over and die.
There are risks.
There's risks to waking up in the morning. So I think that we all have to accept that. I don't think we do very well with dealing with small risks in this society. We don't relegate them to the minor area role that they should play in our decision making.
Yes, because we have all been protected from the vaccines already. But I grew up in an era, I grew up in a country where I saw the spectrum of the diseases all the way to the end. And I've seen kids with measles, encephalitis, and one child after the other, when in fact there's this vaccine right there that can protect that.
Right, you don't have to be paralyzed anymore. You don't have to. The other thing that's come up before we leave this is, and this came up in the presidential debate, this immune stimulation, too much immune stimulation for a little child. Do you want to say any word about that?
Actually, they're talking about the number of shots that the child is getting. So there's really no controversy about that in my perspective. As the baby comes out from the birth canal, the baby's already exposed to millions and millions of bacteria on the skin. So a shot or two is not going to be any different from that.
In fact, there is a whole debate going. It's not a debate. I think it's becoming more and more accepted that depriving children of immune stimulation when they're little is bad for the immune system. I know you're introducing peanuts and strawberries.
Yes, exactly.
We used to think, oh, we don't know, avoid these foods because they were allergenic.
Yes,
it turns out
now
if you
we
get
want to
exposed to them
expose it
early.
as early as possible. We want
And if you
to
think about the way I'm sorry to keep talking, but I'm passionate about
No,
this.
I just want to say, though, except that argument does not carry forth to say, well, just let the child get the disease.
No.
Yes.
No,
and so
but
that's an important
There are
distinction
certain
to
things
make.
that you want to, yes.
But we evolved in an environment of tremendous immune stimulation. In dirty environments, lots of microbes. You say the baby comes out, they're covered by millions, billions of bacteria. So I think there's this excessive worry about a few immunogenic
the worry
challenges.
comes
Silly.
out because the diseases have been prevented effectively by the vaccine. So while we are actually enjoying the fruits of having a high level of vaccination in a population, the problem is that we need to continue keeping that immunity level. We have this term called herd immunity. So we need to continue vaccination because otherwise that immunity level will go down in the population, and then we're going to start getting those diseases like
right,
that.
and some of these diseases we have eradicated by vaccination, particularly smallpox.
Totally eradicated and all just in the laboratory. So
these diseases that had to have humans to exist. So some of these, again, herd immunity I think is really important. If we all got vaccinated, we might be able to eliminate some of these childhood diseases.
That is the reason why we have a social responsibility to get the vaccines, because we can't just say, okay, my child is healthy, I'm not getting a vaccine because I'm not causing anything. Well, you are contributing to, possibly causing the next epidemic.
And we, in fact, have seen in the United States when there are regional areas in which vaccine rates drop, that diseases come back that had not been seen in large numbers,
like California, where everybody has decided that they're
and in fact, in California, they have mandated, no more religious exemption. So you got to be vaccinated to be in a social environment like that.
So maybe we can talk a little bit about the specifics of what diseases are we preventing with vaccines?
There's a lot of diseases. That's why it seems like there's endless vaccines. But by 4 or 5 years of age, it will slow down. But we keep on giving those vaccines.
Can you give some examples? Some of the ones that
you were talking about the serious ones like meningitis, right? We're talking about meningitis, which is a brain infection, and you don't have a chance to choose if you want to, be well or you just die. You die or you get very sick, you get complications. We're talking about whooping cough that can cause, months and months of coughing. We're talking about polio that can cause paralysis. We're talking about flu that, a baby could just easily die.
Everybody gets flu.
Yes, so if you say, I'm just going to get the flu and I'm just going to catch the flu and maybe nothing will happen to me. Well, we don't see. I think a lot of people don't see that there's a lot of 6-month-olds that could just die.
So between birth and 6 years old or 6 months, what are the vaccines that parents get? And then
there's a lot.
Here we are. This is the birth to 6 years, actually.
Yes, so we do have the hepatitis B, we have rotavirus, the diphtheria, tetanus pertussis, Hib meningitis vaccine, Prevnar, polio, we have hepatitis A, I'm just going to go through it fast, measles, mumps, rubella, chicken pox.
That's a lot of disease. I think
there's a lot of
diseases, and that's a lot of morbidity. That's a lot of missed school, even if they don't have
That's a lot of diseases we don't have to see right now. I mean, 50 years ago, we had to deal with that. So that's my point.
And maybe we could say a couple words, too, about the papillomavirus vaccines. Because here we have vaccines now that we know prevent cancer.
Yes.
And I know there is social controversy about this, not about the disease, this working.
Well,
but
it is still it's not a requirement, it's a recommendation, it's still the parent's choice, or it's still the person's choice, or an adult's choice to get the vaccine. And the reason for the vaccine is that they have discovered that HPV is the cause of cervical.
That's
It's
a virus.
It's a virus, human papillomavirus, that is the cause of cervical cancer and other cancers. So what the next logical step is really to find a vaccine and,
But the vaccine only works if the people haven't been infected yet. And once people become sexually active, they generally acquire the virus.
I want to go back to the vaccines. I just want to stress that, it's not just vaccines And whenever you want to get the vaccines, there is a timing importance.
That's a really important point.
Yes.
I mean, there are times when individuals will react best to the vaccines,
yes.
but also sometimes we repeat vaccines. Maybe you could say a few words. Why do you get the hepatitis B vaccine three
yes.
times?
Yes. So the reason
whatever.
for some of those repeats, well, the recommendations are based on scientific evidence. So the scientific evidence shows that, it's not enough for one dose of vaccine to bring immunity to that
you get
disease.
some immunity, but not enough.
Yes, you
immunity.
may have a little bit of immunity. It goes down, then you need to get that second dose, and then you have to get the third dose. But at this point in time, we know that for hepatitis B, we need those 3 doses given at those correct time, correct spacing, and it will produce hopefully lifelong immunity. Yeah. I want to talk about non-responders also.
Okay.
So the vaccine non-responders. So it doesn't mean that you get the vaccine, you get 100% protection. Of course, nothing is 100%, right? So there are people who may not respond to vaccines, which brings me to the importance of herd immunity. So meaning we need at least the population to be mostly vaccinated so that those who don't respond to the vaccine will continue to be protected from the diseases.
And there are people who have subtle immune disorders where they won't respond
yes,
as
they
well.
will not respond,
some of those
right?
are not all that uncommon.
And we are talking about just regular people who get vaccines, healthy people, they may not respond, right? So their immune system
which is different from saying that they're not effective overall for the vast majority of people. These are uncommon individuals who aren't responding.
Yes and no, but you do have a certain percentage that don't respond, right? So,
how about vaccines for preteens and teens?
Yes, we're talking about boosters actually. So boosters for tetanus, because we know tetanus is never lifelong. That's why we always have to get it every 10 years, the tetanus vaccine. We added there the pertussis, so we need at least 1 dose of pertussis, after the first 5 doses, so we could have hopefully some.
But this website's available. If there's a lot here that the viewers, I'm sure, can't see.
It
is available through the CDC.
Yes.
Online, so people should feel free to go to
yes.
see whether they're vaccinated.
And
even
the
pertussis,
details.
the vaccine has been upgraded in recent years to the acellular pertussis.
Yes, yes.
And that's
so
a better vaccine.
Through the years, it has become safer and safer, and every time we find something that's safer, we will do it to the vaccines. We will add it to the recommendations.
I want to say a couple of words about flu, influenza.
It's also controversial for people, but for me, there's no controversy. I'm sure, I don't know how you feel about flu vaccines, but flu vaccine, although it's really hard to make the flu vaccine because you are manufacturing it the year before. You're trying to predict.
The flu changes every year.
Yes, you try to predict a year ahead, of what's going to be active.
So the flu vaccine, even if you respond to it, may miss in 15 or 20% of people.
Yes, and we know that. But I would rather, it's like riding in a car. I could not be hit by a car, but if I'm gonna get hit by a car, I wanna be on my seatbelt.
And again,
so that's like the seatbelt.
We only have a couple seconds left, but just to mention that people think of the flu potentially as being like a cold, but it can be a very, very serious disease, especially for the young and for the elderly.
For the elderly. So the extreme ages in the population, they are the ones that are going to die and be very sick from the disease.
Great, thank you.
So much good information. Thank you so much.
Thank you.
That's all we have time for right now. We'd like to thank today's guest, Dr. Lalaine Mortera, and we'll see you next week on Health Talk.
Be well and stay up to date on your vaccinations, no matter how old you are.